We are homeopaths, right? We are different from allopaths. We do exactly opposite of what they do. They suppress, we try to cure. They give harsh doses, large doses of medicine, we give minimal dose. They give multiple repetition, we give minimum repetition. So when we do everything different from them, why should we study homeopathy according to the allopathic system of medicine? The approach in allopathic system is of disease approach. But you know, in homeopathy, we do not treat diseases. We treat human beings who suffer from diseases. So whether he is suffering from a ENT problem or a GIT problem or a respiratory tract problem or a neurological problem, what difference it makes to us? Does it make any difference to us? No. We need to know how to treat diseases. We need to know how to treat people suffering with diseases. Not only just diseases, people, those who suffer from these diseases. In our college, in our institutions, wherever you have passed out from, you know, we have been taught, oh, okay, we give 4 drugs for dysentery, give 4 drugs for sinusitis, give 3 drugs for irritable bowel syndrome, or give 3 drugs for constipation. See, that is what the approach is different. When our principle, or when homeopathy itself says that we do not treat diseases, it doesn't matter to us what the disease is, then why do we have to have papers where we are going to write 4 drugs for dysentery and 4 drugs for cold and cough and 4 drugs for sinusitis? So we should learn a way where a technique or a method by which we can treat any patient who walks into our clinic, whether he is suffering from A or whether he is suffering from B or whether he is suffering from C or whether he is suffering from Z. This approach in the college is what makes you limited, and then when you come to practice, what happens? Because you have been trained that way for 4 or 5 years in your college, you have seen your teachers also probably doing the same thing in their OPDs or in the college, your mind also tends to be the same way. As a result, what happens? When a patient comes to you, you see the allopathic diagnosis. Usually what happens to us is, people come to us after they have been to most of the time, right? They have been to allopaths, they have taken n number of medicine, they have been to n doctors, and then they have come to us. So we have a big list, they have a big file. So you know the diagnosis. So as soon as you see, okay, this patient is suffering from dysentery or this patient is suffering from IBS. So you start thinking, okay, IBS, Nux vomica, colchicum, Ipecac, mercury, mercor, sulfur, you start thinking that way. As a result, you get biased, and then ultimately neither the patient benefits, neither you benefit, because the patient is not going to get better totally, or if at all he is going to improve, he is going to improve symptomatically, which is as good as allopathy, where they have taken allopathy, they take allopathic medicines, temporarily they are okay for a few days, again after 10-15 days they are again worse, or after a month they are back with the same complaints. Then what's the difference between us and them? We claim that, okay, homeopathy cures. How can homeopathy cure? Homeopathy can cure only if we go and treat the human being and not the disease. So that's why we are going to have a little different approach, okay? And I'm going to teach you not just how to, and what happens in the seminar, or any lectures. What is the idea that with which we go? I'll make it more interactive. Let's make it more of a nice, congenial. It's a very small gathering, so we can make it more approachable and very nice, and for not make it very formal, keep it very casual. So what is the intention? You tell me, now everybody tell me, what is the intention with which you came to this course or to this lecture? What was why you came to this lecture? You tell me, why you came to this lecture? Yes, what?
To get that skill, how to
okay, that is what I said. So you good. If you have come for the skill, I am very happy. I will congratulate you. I will clap for you. But tell me, frankly, from your heart, tell me, how many people here came to learn some remedy for some cases? Tell me, how many of you came here? Anybody? Yes, everybody. I am sure most of you came with this opinion कि आज जाएंगे, okay, आज ENT के ऊपर lecture है, ENT में sinusitis, coryza, ear discharge, otitis media, whatever XYZ disease के लिए आज मुझे remedies मालूम पड़ेगी, वो remedies में अच्छे से लिख के आऊँगा, फिर बाहर कर लूँगा और फिर patient में आएगा तब देखूँगा. This is what used to happen to me also. Don't worry, it's not happening to you only. It used to happen to me also. You know what? I used to attend after. Very sorry to say that when we left our college, we were so much lacking in confidence. We didn't know what to do. The only thing I was sure of, that at least I want to practice homeopathy from day one. I didn't go to allopathic hospitals and take allopathic courses and all that. Only thing I was sure was that I want to practice homeopathy, but absolutely zero knowledge. So, and as you know that even if you know something from the Materia Medica books, the theory, when you come in practice, it's very different. So when I started attending clinic, I found myself lacking very much in knowledge and not being confident at all, and then fumbling what to do. So I started attending seminars and lectures on weekends. Sunday कहीं भी lecture हो, कहीं भी पहुंच जाता था, all over India. I traveled in fact to attend lectures all over India. Every Saturday, Sunday I used to pick up my bags and go everywhere. People used to always say, why are you running so much? But I wanted to learn, and with the intention I used to go to the seminar was, and of course in those days when you are a new practitioner, you're not having much income. So I used to calculate every penny. So I used to go to this, first of all, so when I get a brochure, I used to see fees. उस ज़माने में तो अभी तो हम बहुत we have to talk of उस ज़माने की बात, no, because it's been quite a bit time. And I started practice was in 1984. So in 1984, the seminar fees were 100, 150, 200 rupees. And then you calculate the traveling cost. Okay, 20 रुपया जाने का, 20 रुपया आने का. मॉर्निंग से जाके आएंगे तो चलेगा, अगर कहीं रहना है तो छोटा सा सस्ता होटल. So all that I used to calculate. So suppose 200 rupees for seminar fees and 200 rupees some other expense. I used to calculate 400 rupees हो गया. चलो अभी जाने का सेमिनार में. What I used to think was, at the time I used to charge 20 rupees for the patient for the weekly medicine and 20 rupees consultation. So 40 rupees. So I used to always think 400 रुपये खर्चा ये सेमिनार में, मुझे कम से कम इसमें से 4 से 5 रेमेडी सीखने को मिलना चाहिए. Why? If I learn 5 remedies, I come next day to my practice, I apply those 5 remedies to the patients, give them, they get better. Those 5 में से मुझे एक पेशेंट के ऊपर 40 रुपया, मैंने 200 रुपये मेरा निकल गया. अभी 200 बचा, वो जो पेशेंट अच्छा होगा वो फिर दूसरा 5 पेशेंट रेफर करेगा, उसमें से 200 निकल जाएगा. So next seminar of mine used to wait till I recover that 400 rupees of my cost. And what would happen was, if I see one case of a very fantastic remedy, because always what happens in seminar, the speaker has to show. If I show you a case of pulsatilla or natramure or bryonia, you say, तो हमको भी आता है, कॉलेज में सीखा था. You want some fancy remedy, no? So the speakers used to come with some fancy remedy. So at that time, even Naja was a fancy remedy for me. So I still remember once I went to a seminar, I attended a case and they showed a fantastic case of Naja. The first thing I came home and what did I do? Called up my pharmacy, Naja 30-200 potency में भेज दो जल्दी से फटाफट 1 drum liquid. Because I did not even have in my clinic. और नाम भी पहली बार सुना था. फिर मालूम था कि बुक्स में है लेकिन कभी पढ़ा भी नहीं था, वो तो ऑप्शनल में छोड़ दिया था ना एग्जाम के टाइम. So I left it for optional. So first thing I do is I called up the pharmacy. So this is what used to happen. ऊपर से वो भी खर्चा रहता था. First thing I do is अभी नहीं देना, अभी नहीं, बाद में. I'll tell you when to give, not now. I'll tell you. So our first thing I do is do that, and then next day I start waiting for every patient. Every patient who walks in, to me it looks like Naja. And I'm reaching to give them, So at least next day 3-4 patients को Naja दे दिया. And then after a week they come back. Sir, कुछ फायदा नहीं है, कुछ अच्छा नहीं हुआ. And then you fall flat on the face. Because that is what the intention with which I went. I wanted to know remedies. Every homeopath, when you attend any seminar, in your daily practice, when you attend any lectures, or in every case, what he wants to treat or what he wants to know is, and when we are trying to learn Materia Medica also, we want to learn how to arrive or how to remember remedies so that we can prescribe. So what I am going to try to teach you is, try to a simple method which I cannot finish in 3 hours, but I will try to make it concise and short and just give you an idea that this also you can do in your own practice also. This I have derived on my own with of course help from a lot of other teachers, but you can also do it in your own practice. Is learn how to remember and how to prescribe for patient remedies. This is what we want, right? We all come to the seminars and lectures for this. So we will go go and try to treat a human being, and then at the same time remember those remedies nicely so that we can use them again and again for other people also, right? So that's what we'll do. There's a Chinese saying which says, if I give you a fish to eat, you all come with the intention of having a fish. So if you have a fish, you learn 2 or 3 remedies, okay, fine, you will go home and you will be able to only use those 2 or 3 remedies what you have learned, but rest of the remedies you will not be able to learn. So rather than